Hi everyone, my name is Alexa Kane and I will be presenting a case study of spasmodic dysphonia. Client LB is a 41-year-old female. She is a healthy, active mom of 2 young children and has no history of medical illness. She enjoys working out and traveling around the world with her family. She is the Ad Operations Specialist at Condé Nast magazine. Her occupation requires her to hold daily team meetings with coworkers. LB expressed that for about 6 months she has had symptoms of a strained, strangled vocal quality with abrupt breaks in the middle of vowels during phonation that become much worse under pressure, especially when she has to run the meetings at her job. She also expressed that these symptoms are more prominent when she first wakes up in the morning. When she visited her primary physician about 4 months ago, she was told that she had a cold and it was probably due to the change of seasons from fall to winter. The doctor advised her to drink a lot of tea with honey, that way it coats her throat. 6 months later, the symptoms have progressed and seem to get worse when she is under pressure and in stressful situations. LB decided that she needed a second opinion. She made an appointment with a team of professionals that included a speech-language pathologist, an otolaryngologist, and a neurologist. They gave her an extensive evaluation. First, LB was asked to fill out a detailed case history that consisted of her personal background and medical history. Next, she was asked to fill out a voice handicap index, which is a 30-item self-administered questionnaire that has an individual describe their voice and the effects of their voice on their life in terms of function, physical, and emotional state. A video stroboscopy was used to evaluate the vocal folds in action in a magnified slow motion. The otolaryngologist observed hyperadduction of the vocal folds and the spasms that occur, causing the vocal folds to slam together and stiffen. Next, an acoustic analysis was measured. The SLP had LB read a rainbow passage, which is intended to bring out voice breaks. LB presented with many voice breaks between every 2 to 3 words, especially during vowels. Finally, since spasmodic dysphonia is a central nervous system disorder, it was imperative that LB go through a neurological examination to look for signs of neurological problems. Through this extensive evaluation, LB was diagnosed with adductor spasmodic dysphonia. There is no cure for spasmodic dysphonia. However, there are several treatments and options that exist for voice improvement. The first option that was brought to LB's attention was voice therapy. This was recommended before botulinum toxin treatment. LB attended voice therapy twice a week for 45-minute sessions. It gave her strategies to use. However, she felt that when she was under pressure or stress, those symptoms were still prominent. As we know, this is also a progressive disorder, and over the past year, LB has seen a huge decline in her speech, so botulinum toxin treatment was highly recommended. When LB began botulinum toxin treatment, she felt that it was most beneficial in the first 6 to 8 weeks. In that first 6 to 8 weeks, LB presented with less abrupt breaks in her speech and less of a strangled vocal quality. LB decided that she was going to continue the treatment in conjunction with voice therapy in order to help improve her vocal quality as much as possible.